Hello, everyone. Welcome to Vibrant Living Now. I am your host, Julianne Wutke. And if you're watching this on the YouTube channel and you're getting some great information here, be sure and hit like and subscribe. Ooh, so today we have a very special guest. I'm excited to introduce you to Katie Milano. She is a doctor of physical therapy and a yoga instructor for over 20 years. She did her doctoral thesis on exercise and on treating exercise and treatments for urinary incontinence, and as an exercise specialist for women through pregnancy, postpartum, and menopause. She treats from more of a holistic mind-body approach and caters to the individual's body and lifestyle needs. And I met Katie last month, and as soon as I found out more about what she did for people, it just seemed to fit right in with what you all, our audience, is interested to know about now. So anyway, Katie, welcome.
Thank you so much, Julianne. I'm
Great.
honored to be here.
Yeah, sure, that's great. So let us know. Now, this is a topic that I know you and I talked about this a little earlier. It seems to me that years ago, people just weren't talking about this. Is that your impression as well?
Absolutely. I think that's why I really got into this topic in the first place. Urinary incontinence or bladder leaking, it's so common. 1 in 3 American women actually suffer from urinary incontinence at some point in their life. And many women suffer with it for 20 years plus, or they always deal with it. It's become something that is so normalized in our culture.
Mhm.
And I have women that have told me, I tell them I'm treating this, I've done a course in this, and they go, "Oh, well, thank God I don't have those issues." And 5 minutes later, they go, "Oh, well, I sometimes leak a little or I pee a little when I laugh." And I'm like, that is urinary incontinence. And it's so normalized that they don't even recognize that it's an issue. And
Mhm.
I think that it becomes embarrassing and shamed, and we don't talk about it because we are embarrassed, and we don't talk to our doctors about it. Research shows that it takes women almost 7 years before they ever talk to their doctors about this.
Oh my gosh.
Only 30% of women ever even seek help. So that means 70% of women out there just deal with it because they believe just a little bit is normal.
Mhm.
After pregnancy, it's normal. When we hit menopause, it's normal. We just put a pad in. If you look up the treatments for urinary incontinence, if you just Google treatments for urinary incontinence, the first thing that comes up is absorbent underwear and pads.
Hmm.
Is this I don't understand how that's treatment, right? It's a putting a bucket under a leak. You would never do that in your house. You wouldn't have a leak in your house and just put a bucket there and forget about it for the rest of
Mhm.
your life. You would get somebody to come fix the leak, or you would
Right.
learn how to fix the leak yourself.
Yeah,
So
it seems to me that it's maybe, I don't know, if, and again, we go to Dr. Google all
yes,
the time,
exactly.
right?
Dr. Google,
To find
right?
out so if it were me and I'm looking at all these, I mean, my options online would be, what I think, because I'm embarrassed to talk to my doctor. I don't think it's important, not a big deal. I'm
Yeah.
certainly not going to talk to anyone else about it. Maybe a couple of people, I don't know. But you're right, I'm just going to be dealing with it. And then I see that online my options are surgery or just, using pads, and that would make me feel very disempowered. So tell us I mean, is there something available to us besides always having to go to the surgical option or just keep
Yeah.
using Depends for the rest of our lives?
Yeah. Yeah, and that's sort of where I think there is a lot more education coming out around treatments during menopause and after pregnancies. And I'm so grateful to see so many incredible people out there starting to learn and teach about this at this point. And that's also what I have just become really passionate about is really just the educational side of this, and understanding what's normal, so that when we understand that, little things like our bladder can hold up to 2 cups of urine. A lot of women suffering with frequency, that means going to the bathroom more than 6 to 8 times in a day. And when you start calculating that, you'll feel or you'll see like, oh, wow, I do. I go to the bathroom 12 times a day. Oh, that's actually more often than necessary. And maybe I can shift that. It's empowering, right? And that's kind of what you were saying is it's so disempowering to always be putting a pad in and just dealing with it, not really getting to the root of the problem. And it's not just about exercise, in other words. There are a lot of exercises that can support the system, but we also need to look at, historically we were told as women after pregnancy, just do your Kegels, right?
Mm.
One, most women don't know how to do a Kegel. That's a number one problem. Two, you start trying to do it and you're like, I don't know if I'm doing it right. So you kind of fall off the wagon because you don't really know if you're doing it right. How effective is it? And the other thing is that, again, the pelvic floor doesn't live in a vacuum. So it is affected by so many other
Mm.
structures and habits in our life and ways that we move through the world. It's a part of the body. It's a part of a greater team of muscular structures and balanced tissues throughout the
Mhm.
body that we really need to understand what's putting pressure down on the pelvic floor and not just simply strengthen, 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 because this is the number one false thing that we have is we believe that because we're leaking, we are weak or the pelvic floor is loose. That is a big misconception. Most women, it's not all, many women do have a pelvic floor that gets too loose, but oftentimes, more often than being too loose, you are too tight.
Mm. Wow. I would not ever have thought that.
This is a big mic drop for a lot of women. Like,
Yeah.
what? That does not make sense at all.
Right.
But the problem is because the pelvic floor is getting overloaded. I mean, think of, when you're pregnant, the weight of the baby working down on the pelvic floor, it actually causes that pelvic floor to hold a lot of tension, holding that,
Ah,
it's like if you were holding a bag in your arm
ah,
and like this for a long period of time, this bicep would get tighter, 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 and
oh,
it would be hard to straighten your elbow out again,
that
right?
makes sense. Yeah.
So the pelvic floor does the same thing when it's overloaded, 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 you know, um, and there's lots of ways that we overload it. I don't want to get too detailed into that, um, but it basically creates this over tonic or too much tone in the pelvic floor. So when something is already contracted and you go and you load it, it can't hold, it gives,
Hmm.
if your bicep is totally contracted all the way and you put, something jumps on your arm or lands heavy like a sneeze or a cough,
Hmm.
right? That's a quick load on that pelvic floor, then that would give way, and it can't hold the amount of load you're asking it to hold because it's already completely contracted. It has no more to give. It can't
Wow.
contract any further.
Yeah, that makes
So
so much sense.
yeah, so a lot of women with this issue, the other side of that is because we're holding a lot of tension. um it's a relationship of calming the nervous system. It's getting the pelvic floor to actually relax.
Mhm.
And sometimes that's the first thing we have to teach women is where is that actual resting tone of the pelvic floor so that you can get a good contraction. You have to get it to relax before you can get it to work again.
Wow.
So this is really a mental shift for a lot of women, and it's something I really love teaching because it allows you to start letting go of all this need to do Kegels, and it gives us a lot better understanding of the tissue as a whole and as a part of the team within the body.
Oh, that is so awesome. I love this. Yeah, I would never have thought of that. As a matter of fact, I remember seeing a class and there's this whole online training thing with this particular, I think she was a personal trainer,
Uh-huh.
and it was all about strengthening the pelvic floor. And I'm like, oh, well, that's kind of interesting. I'm interested in that. Huh, what do you know? I mean, in general, right?
Right.
Um, and um, I don't know. I think I have a sense that she wasn't, maybe that approach isn't quite as holistic as what your approach is, which sounds a 100% like the smart thing to do, because you're right, everything is connected to everything else. And if you don't really understand it, how can
Yeah.
you help yourself, you know?
Yeah. Yeah. When we go to treat urinary incontinence and all we look at is the pelvic floor, I think we're missing a big piece of education, and we're missing a big piece of opportunity. It's such an opportunity for women to get more in tune and more embodied in their whole body, and to start including the pelvic floor as part of the holistic being that we are, and
Hmm.
understanding how it works in the whole system, because we tend to dissociate from this part of our body, because and our American culture has been very um dissociated from our sexuality in general,
Hmm.
and the
True.
pelvic floor, when it is healthy, we are able to have a lot more pleasure in our sexual life as well. And I think that's a big piece of this, as being it's holistic. It affects every part of our life, not just our ability to void at the correct time, right?
Hmm.
It's also our ability to experience pleasure.
I love this. Oh my gosh. This is such, I mean, I am actually hearing things that I hadn't heard before or hadn't really thought. And I think about this kind of stuff, mind, body, all the time. You know
Yeah.
that. Oh, I
Yeah.
love this. Yeah, it has been my experience, just working as a health coach, and especially with women over 40, over 50, that I've seen where if you just kind of start your journey someplace, right? Because you've got a particular thing that's your issue, your problem. And if you just kind of put one foot in front of the other, all of a sudden, oh, well, then you start noticing that and you start noticing that. Oh, well, that got better. Isn't that exciting? I'm more inspired and empowered to do that now. And before you know it, a few months, a year, a couple years have passed, and you could just completely turn your health and wellness around, so I love that. I love this. Well, so it's not just, what I'm hearing is that uh it's not just for, so what you're, you know the kinds of remedies or things that you might suggest for women and men, I'm sure as well,
Yeah.
are not just for a particular problem of urinary incontinence. I think it sounds like if you actually learn more about this topic, or try to help yourself maybe be proactive or what have you, it's probably going to touch on almost every area of your life.
Every area.
So it
Yes,
seems like anybody
absolutely.
could be benefiting from knowing more about this.
Yeah, I 100% agree. I mean, and every issue in the body that we want to start addressing and want to become more holistic in, there's always the mental game, the
Mm,
mental shifts that really have to happen, right? We have to understand what we believe. That's a big piece that I go through in my program on this, is really rooting out our sabotaging beliefs, because especially with urinary incontinence, we've received so much information from the world around us that this is normal, just kind of deal with it, and it's no
mhm.
big deal, right? It's
Yeah.
no big deal is a lot of what we get. And yet we don't even notice when our friend asks us to go dancing and we go, no. Inside we're going, yes, I want to go. I would love to do that. But
Mhm.
but externally you go, no, I can't do that because you're afraid you're going to leak. Or women that, they don't go to the grocery store because they don't know where the bathroom is, or, it's like they plan their whole life around it and they don't even know they're doing it.
Mhm.
And they start extricating themselves out of exciting life things that they want to be able to do, and they just kind of normalize and go, oh well, I'm getting older, or any of those excuses, and we don't even recognize we're telling ourselves these stories that are not true. They're not true.
Oh,
and
yeah.
and there are ways we just start limiting ourselves. with our belief. So we have to address the belief system. We have to understand what's normal. And then it's almost easy once we really start seeing that it's almost easier to make those shifts, right?
Mm.
I mean, I have women all the time after my very first lesson in this course that say, my urinary incontinence is over 50% better just because I know now that my bladder actually can hold 2 cups of liquid or urine. And I was going to the bathroom every 30 minutes or every hour.
Wow.
But what I realized is that I can control that, and that they understand how to slow down an urge. I teach them techniques of how to calm their nervous system, how to distract themselves, how to stop and not always give in to that urge, because it's just these sensors on the bladder that are telling them that the bladder's full when it's not really. It's like the
Hmm.
body starts learning to trigger you to have an urge sensation before the bladder's full, because you trained it to do that. Because as little girls, we were trained, go to the bathroom before you get in the car, go to the bathroom before we go to the amusement park, go to the bathroom before we go to grandma's. We always were going to the bathroom just in case, which
Hmm.
trains our whole nervous system and our bladder to think it has to go to the bathroom when it's not full.
Wow.
It creates our urge. It creates this increased frequency when we're going to the bathroom just in case. So just when you start noticing like, oh, I should go to the bathroom before I go to the grocery store. Do you need to go to the bathroom?
Hmm.
It's like when we start questioning those patterns and those habits, then we start changing everything so quickly.
Yeah, that is so awesome. Oh my gosh, I can't believe I'm saying this, but I am learning so much today. It's actually going to change some of my, it's going to change the way I'm thinking today. Like
Yeah,
I'm going to be a
good.
little more conscious about, huh, yeah, do I
Yeah.
need to do that or is that just a habit that I've gotten into? This is awesome.
At nighttime also, if you get
Mm.
up 2, 3 times at night,
That's a big one.
yeah,
When you
women,
wake yourself up. Oh my gosh.
yeah. Yeah, and this is a big problem as women get older as well. When they're getting up that much at night, you're disturbing your sleep. You're at higher risk for fall. You're at higher risk to end up in the hospital with a
Mm-hmm.
broken hip. It's number one. And urinary incontinence is a big lead up to that big issue of falling and breaking a hip and ending up in the hospital. And it's a quick way to end of life.
Oh
It's
my
like
gosh.
all these little things are that start building on each other and set us up for this. Women with urinary incontinence are twice as likely to go into a nursing home
Oh
than
wow.
someone without urinary incontinence.
Oh, that's great. Well, yeah, and it's because, and also I'm sure that urinary, it's because it's related to everything else that's going on, loss of, you know, muscle strength in
Yeah,
general,
right.
probably 10 or 15 or more other things,
Yes,
that they're
exactly.
not
Everything builds on
addressing.
itself,
It
right?
really does, but I love this. This is a great way if anyone, especially if they've got this issue or they just want to be proactive. This is such a great topic because it just touches on everything else. And those of us, I got to tell you that most of my girlfriends, I mean, when we're comparing, because we're talking about sleep, I'm a big promoter of sleep
Yes.
being a superpower for people. We need to get our, but when it's disturbed by 2 times, 3 times getting up in the middle of the night, to
Yeah.
go to the bathroom, that's not that's completely, I think, addressable, you
It's
know.
actually a clinical diagnosis if you're getting up more than twice a night. It's called
Mhm.
nocturia, that you're
Oh,
peeing too often at night. Uh,
interesting.
yeah, and it's a diagnosis because it can create a lot of problems down the road. I mean, it's again one of those things that we go, oh, it's no big deal. It's no big deal. It's no big deal until it is a really big deal. We don't
Yeah.
realize how those little things are affecting us. It's those chronicities that create such issues down the road. And when we can start nipping these little things in the bud and understand how to address them, and understand how the system works a little bit better. So we're empowered in it. It's like when we feel empowered, it's there's nothing more than that I love. There's nothing I love more than watching people feel empowered by
Mhm.
information.
Oh,
It's
absolutely. I love this. I
just
love it.
exactly what you do too. That's why I love the name of this podcast. I love, what you're doing for in educating, women. It's such a need right now in our society to
100%. Yeah. Absolutely. And there's probably it's probably never too early to start considering this, especially for women who are raising children and have, pregnancy right now. So yeah, so and so you mentioned, I'm sure you've got a ton of resources to help people. So just let us know, what are some of those things that we can do to find out more or to actually engage in helping ourselves?
Yeah. So I have a program that I have developed. It's an online program. You can do it self-paced, or you can do it with individual trainings from me, as well as the self-paced videos and as well.
Hmm.
Um, and you can also work with me one-on-one. I do Zoom trainings, and I can do assessments on people via Zoom actually really well. And I do one-on-one if you happen to be in the Santa Cruz area. And
Hmm.
then there are lots of resources here in Santa Cruz, public health physical therapists that you can see and really get more one-on-one assessments and training. Um, yeah, and we're really starting to understand more about it, but to date, there's not really anything else that is addressing urinary incontinence specifically that I
Hmm.
have found as far as educational programs. But there are many on menopause, which address urinary incontinence and hormone kind of
Mm-hmm.
imbalances.
Yeah.
I've seen some of those pregnancy, postpartum, programs for training and things like that, which will address some pelvic floor issues.
Hmm.
Yeah, so there are resources out there, and I'm happy. I know in your show notes you'll have some of the links, and I'm happy to
Oh, absolutely.
share
I think, as a matter of
links.
fact, yeah, if anyone were to go to your website, katiemilano.com,
Yes.
they would just see a whole bunch of things, because obviously I looked at your website. I'm always curious, like, oh, what's going on here?
Yeah.
And I love that you've got this course. And I feel like it'd be an awesome thing for people, like I said, people to do just for general information, or even just to be more proactive,
Yeah.
especially those of us who, we don't think it's a big deal right now. Oh, my girlfriends say the same thing.
Mhm.
Well, maybe I don't want it to become a big deal.
Yeah. Yeah, exactly. Exactly.
Yeah. So,
And we can all learn, how the system works, because when we understand something, it's so powerful because it embodies us. It makes
mhm,
us feel like we understand ourselves. We don't need outside information bombarding us as much when we learn to trust our bodies. We learn to
mhm,
self-assess where we're at any given stage. And we continually self-assess. We continually self-assess our posture, how it's stacking up, how is that affecting my pelvic floor? We understand, again, how
mhm,
that pelvic floor is part of the body and how other things are affecting it, so that we can assess ourselves and how much pressure are we putting down. I love this little trick. I'm going to give us a little trick
oh
right now.
boy. Okay.
So incontinence is basically when the inside pressure is greater than the outside pressure. And if we talk about the inside pressure, it's the contraction of the bladder. The bladder is a smooth muscle, and so that means it's regulated by the automatic or the autonomic nervous system. That's your sympathetic and your parasympathetic, right? So
Mhm,
that's your fight or flight, that anxiety, as when we're really stressed, we have more incontinence, right?
mhm,
Okay, so that inside pressure is the contraction of the bladder, right, which is controlled by the brain. The outside pressure is the pelvic floor contracting to
mhm,
hold it. So if we think about the bladder like a water balloon, and we think about the pelvic floor is like the knot in the bottom of that balloon,
mhm,
right?
mhm.
So I'm going to have you use your mouth to just give you this example of sensation, okay? So if you blow up your cheeks, I'm going to talk for a second, so I won't be able to do it with you right away. But if you blow up your cheeks, you hold your lips closed really strong, right? That would be your pelvic floor. This is the bladder, right? If you push on your cheeks with your fingers, that's basically your brain contracting your bladder, right?
Mhm.
How strong do your lips have to get to sustain the pressure that you're putting through that bladder with your fingers? right?
Yeah.
But if my lips give way, that was my pelvic floor, maybe not quite strong enough, right?
Hmm.
Or maybe my bladder is being contracted too hard. Maybe my fingers are pushing too hard, meaning maybe my brain is giving my bladder too strong of a signal to contract. And my pelvic floor is not too weak at all. It's just my brain is telling my bladder to contract too much, right?
Mm.
So
Hmm.
which side of it do we need to train?
Hmm.
Right. So this is
Interesting.
a fun little just self way to understand, how that bladder to pelvic floor works.
Hmm.
Um, and yeah, it's just, I have lots of little ways of feeling your pelvic floor, understanding how the breathing diaphragm affects the pelvic floor,
Hmm.
how our breath affects the pelvic floor, how our glottis, which is our other diaphragm, in the back of the throat, all three of those diaphragms stack up on top of each other and they all affect the pressure down on that pelvic floor.
Hmm.
So the position of the head really affects how much pressure you're getting down on the pelvic floor. And
Hmm.
it's just fascinating when you start to go, oh, everything in my body is so beautifully connected.
Oh, I love this. I'd love to see a workshop. I mean, I love that you've got the course, you've got
Yeah.
consults, and you can do assessments online. That is wonderful.
Yeah.
Because not everyone is going to be able to see you in person. So
Yeah.
that's always good news. But I really feel like a workshop would be a really good thing. I'm looking forward to it. We'll talk about that more. I feel like
Okay.
this message really needs to get out to a lot of people.
Thank
That is really, we've gone over time just a
you.
little
Okay.
bit.
No, I
We
know
were
we
all
gotta wrap
excited
it up.
about this. Anyway, I want to thank you for being our guest today, and I will for sure put all of your contacts and information in the show notes. So to our audience, be sure and take a look for that. Until next time, this is your host, Julianne Wutke, and it's been Vibrant Living Now.